Please welcome your session speakers for future livability, ageing strong and living well, Dr. Shirley Bowen, Director General, Department of Health; Graham Pryor AM, CEO and co-founder, Hall and Pryor; and Nicola Brischetto, WA Executive Director, Property Council.
Well, good afternoon, everyone. I don't often, as Director General, get to imagine, but I'd like you to imagine we are in 2050 and Perth is an amazing city embracing innovation and sustainability in healthcare. In 2050, I want this healthcare system to be accessible for everyone, adaptive and anticipating all the changes we've just been discussing in terms of AI, innovation, etc. It should be a system where digital health is universal. Every Western Australian should have a personalised digital medical record powered by AI and genomics, precision medicine, real-time data being fed to such a record from wearable and implantable devices. These are tools that we need that don't just treat illness, they will at that time predict it and prevent it. Virtual care should be the norm. Whether you live in the heart of the city, outer city, or remotely, you can access world-class care through telehealth, virtual hospitals, and AI-assisted diagnostics. Our hospitals will be smarter and greener. Our health infrastructure should be powered by renewable energy, designed for climate resilience and integrated with smart technologies that optimise patient flow, reduce admissions and enhance safety. I'm going to say ramping is a thing of the past. Perhaps though, the most transformative change will be the rise of digital health, not just as a tool, but a whole philosophy of care. It will change how we deliver care as doctors and clinicians into the future. It will release time for us to actually care. At the heart of this transformation will be the single digital front door, a seamless, intelligent platform that connects every Western Australian to the right care at the right time, in the right place. Whether you're seeking advice in the middle of the night for fever for a child, or managing a chronic condition like diabetes, or booking a specialist appointment, the system will triage you so that you are in the right place. And that system will do that using clinical algorithms based on the population, but also based on you and the healthcare you've used before. The system will integrate your digital health record, your wearable device, and even your home sensors to provide real-time, personalised guidance. Therefore, it will reduce unnecessary hospital visits. It will shorten wait times and ensure that emergency departments are reserved for those who truly need them. You could be triaged by a human or even an avatar or a digital algorithm, of course, in the first instance. This digital front door is more than a website, though, or an app. It's a gateway to a smarter, more compassionate health system, one that empowers patients and supports clinicians and ensures care is on time and available no matter where you are. I now just want to briefly move, though, to what we will see in 2050, and that is I'll be old, officially. Probably 1 in 5 Western Australians will be over the age of 65. Imagine, look around the room. It's a lot of us. This demographic shift is a call to action. We are embracing this change by reimagining ageing, not as a challenge, problem, but let's call it an opportunity. Our communities will be equipped with age-friendly infrastructure, integrated aged care services and supportive housing models that allow older adults to live independently, with dignity and with purpose. We will have invested in great home care and dementia research. Our health system will be better equipped to manage chronic conditions, support carers and ensure that every Western Australian can age well. We need to focus on preventative health in the second half of life, not just in children. And that will ensure that lifespan gets close to health span. Finally, due to a lack of humans, our healthcare workforce of the future will be scaffolded by robotics and be interdisciplinary, digitally fluent, and globally connected. Imagine that you can get an opinion from New York, London, on your rare cancer with ease. It's not going to be hard. We will also, therefore, have empowered patients as our partners, co-designing these new services, sharing decision-making, and recognising that health is not something done to people, but it is done with them. As we look to 2050 and the next generation of healthcare, we must continue to ask, what kind of health system do we really want to leave behind? My view is that it is one that is not only technologically advanced, but human-centred, compassionate, and evidence-based. I'm really excited about the future and believe that the 2050 healthcare system will be more accessible and reliable, a really, truly clever health system. Thank you.
Thank you very much, Director General. I'd like to talk about the younger brother of health, the aged care sector. Today we look after about 45,000 West Australians, and that's going to once again double. By 2050, it's going to be of the 800,000 people over the age of 70, will be 800,000 people in 2050 needing permanent care of some form or another. So it is a very complex issue, and I want to make the case in the next 4.5 minutes that the state government and the federal government need to really change policy in the state to really help us invest over $40 billion into the aged care sector to support the state government's operations and hospitals. So is this thing working? Okay, here we go. Anyway, so there are very many reasons why you would enter care. Mainly, the main reason for entering care is that your body itself can't care for itself, and it suffers from one or many, up to 20 multiple morbidities where you do need to enter care, permanent care for the rest of your life, and interchange with hospitals and go on a new journey in your life. Also, people who have a First Nations background over the age of 55, they sadly don't enter care in Western Australia. It is a current indictment on the state, and we do need to address the poor levels of care requirements and longevity for people who are First Nations people. Marital status has a huge impact, economic status has a huge impact, and today we have 42,000 people with dementia in Western Australia, and that will double to over 90,000 people with dementia. Dementia is an insidious disease. I today look after 2,500 of these people, and there's no way out. There's no cure. Of the top 10 disease groups that inflict the human species, there is no cure for dementia. Treatments are coming, yes. I noted the Director General said that the demand will come down. I hope it does. I don't quite agree with that. We have no known cure for dementia at all. So here's some, and this affects every person, every LGA. It affects every family, every company. We've all listened to some wonderful visions of the future, which is incredible in the state for defence, for mining, for technology, for tourism, for the creative industries. I want to make the case for you that we need to also not forget about care. So on the slide here, you will see the populations in the metro area, and every LGA has a living nightmare on your doorstep. Today, I receive, me of all people, 4 or 5 requests every week for someone to care for my mother. Or my father. We had a Royal Commission recently, and it gave us 144 things to do, but no one in the Royal Commission talked about building new structures, new capacities, and to help the future populations. It's a really bizarre time in the aged care sector. So here you've got the LGAs, that's in fact today. Going forward, this is the First Nations people. As I mentioned, the indictment here is that the First Nations people in Australia, generally speaking, do not enter the care program. They do, and thankfully the hospitals in Western Australia do care for these people. I and my people are the only provider of care services for acutely ill Aboriginal people in Perth. That's a very strange concept. Looking forward, you can see the projections here by 2034, and we're off the charts already. The 2 big areas, Stirling and Melville. Stirling will have 45,000 people in 2036 over the age of 70. Just imagine that, 45,000 people. So, what does all this mean? It does mean that we have to have significant investment taking place in bed infrastructure for short-term stay, as the Director General identified before, smart investments into AI and technologies, and I'm a total convert to virtual medicine. We use it ourselves across our country program. It is tremendous. But let's get down to basics. If we have a 2036 a growth between now and then, an escalation of people over 70 by 60%, we will need 10,000 more beds. Or the hospitals have to produce 10,000 more beds. Because when you have severe dementia combined with diabetes, extreme frailty, social isolation, no money, no friends, you will need to be cared for, whether you like it or not. Often your family won't. And there are trigger points where a family will say, or loved one will say, I can't care for my husband anymore, or my wife, or my kid, or my child. I need help, and I need to find care, permanent care for that person. So we do need 10,000 more beds in the state by 2036, and by 2050, we need a further 25,000 beds. And this has to happen. Otherwise, we're walking into a nightmare. Just in finishing, I don't want to harbour this anymore, plus home care packages. Let me quote you from Trotsky. And Mr. Trotsky was a very, very, very intelligent man. And he wrote in his exile, his diary, and Trotsky said, famously remarked in his diary, that each person coming of old age is a completely unexpected event. It's a strange event. It's an event they never predicted. So from Perth's point of view in Western Australia, the care sector cares for people that need permanent care, and their loved ones are relieved of that job, and they can go and work in the big sectors, mining, oil and gas, tourism, governments. And it's a wonderful place to be. We need a lot of support, we need a lot of understanding, because it affects every family in this room, every person in this room, every future family in this room, every LGA, every government officer, well into the future. Thank you for your time.
Right, well, for those of you paying attention, you will notice that I'm not Nicola Brischetto, but it is my pleasure to represent the Property Council here today. I'm going to take a slightly different tack. We've heard a lot today about all the ways that Perth is growing. I think the question is, are we growing up or are we growing out? We've also heard today about jobs, community, skills, and the partnerships that we'll need into 2050. And I think the thread that really underpins and enables all of those is density. So right now, Perth has a population density of just 318 people per square kilometre, one of the lowest amongst Australia's major cities and amongst the least dense developed cities in the world. We're also known as the longest city in the world, spanning 150 kilometres from Mandurah in the south to Two Rocks in the north. As you can see, or we'll be able to see on the screen, if current development patterns hold, we'll be at more than 270 kilometres by 2050. So we all know that increased density is fundamental to the long-term economic and social well-being of Perth and its people. And the state government's target in this regard is really clear. 47% of all new homes should be built in established areas by 2050. But the reality is we're sitting at around 29% infill, and that number has been decreasing. If this trend continues, Perth will miss its target by a wide margin, and that will cost us dearly. So why does this matter? We're in a housing crisis, we just need more homes. Does it really matter where they're located? The answer, unsurprisingly, is yes, it does matter. While greenfield development is going to continue to play an important role in the housing mix, we need all types of housing, and what we currently lack is diversity. In the current market, developing medium and high density housing is tough. The economics often just don't stack up, which is why we need a strong, continuing commitment from government and investment in solutions that make these projects work. So I'm going to look through 6 reasons that go straight to the heart of why increased density is so critical for economic growth, livability, sustainability, and well-being. First up, the cost of infrastructure. Urban expansion is expensive. Every new suburb on the fringe means new roads, pipes, power lines, schools, and hospitals. This costs upwards of $2.5 billion a year. Research indicates the government could save $94 million for every 1,000 lots redeveloped in existing areas. And that's money that could be invested in health, education, and other essential services. Next up, car dependence, cost of living and health. Continued development of the fringes means longer commutes, higher fuel costs, more congestion on our roads. Car-driven cities means higher emissions and ultimately poorer air quality. We'd all agree one of the best things about living in Perth is the lifestyle it offers, but long commutes erode family time, they increase stress and negatively impact both physical and mental health. Critically, higher density brings people closer to jobs, services and public transport. Which leads me to number 3, lower amenity and fewer services. Sparse populations mean less amenity, fewer cafes, shops, cultural venues. Also decreased access to critical services like healthcare, education, social support near people's homes. So density creates that critical mass that we need to sustain hospitals, schools, aged care, community services, and to deliver them efficiently. Number 4 is a weaker CBD and some lost opportunities. A lower inner city population in particular means fewer workers, residents, and less life after 5 p.m. Density keeps cities competitive, attracting talent, investment, and tourism. Perth, as we heard, is the western gateway to Australia and the engine room of our economy. A thriving city centre is essential to draw foreign investment and support the development of new and emerging industries that we've heard a lot about today and that will be fundamental to our economic growth and stability. Number 5, a loss of community and connectivity. Suburban expansion creates distance, both figuratively and literally, and disconnects communities from each other. When there's a lack of housing diversity, it forces older residents to leave their communities in order to right-size. Younger people are forced to move away from their families because they can't afford to buy or maybe even rent in the suburbs that they grew up in. Families fragment, social isolation grows. Density provides that diversity, apartments, townhouses, smaller homes, the whole mix, where people can stay in their communities and stay connected. Lastly, housing choice and affordability. Perth, unfortunately, has one of the lowest proportions of apartments amongst major Australian cities, just 7%. A lack of choice here drives up prices and squeezes renters. More density means more supply, more options and a fairer housing market. So here's the bottom line. Density, we don't think, is a dirty word. It isn't about cramming people in, it's about building a smarter, more sustainable and more connected city. It's about saving billions of dollars in infrastructure costs, reducing the cost of living for individuals, revitalising our CBD and giving people real housing choices. So, my challenge to you all, to the room, let's stop politicising density and development in our existing suburbs. Let's be YIMBYs and embrace density as the key to Perth's future. A future where we attract investment, create jobs and build healthy communities that can thrive. If we want Perth to be a global city by 2050, the time to act is now. Thank you.